Hello, welcome to Intimate Lens. I'm Dr. Katz. This is part 2 in our series of female genital hygiene. And today we will be speaking about vaginal odor and smell and genital hair. So let's dive into those topics. Some body parts have their own scent. If you think about it, your armpits, your feet, the nose, the ear, and the genitals. This is just a physiological fact, and if and when you notice genital scent, you should not be alarmed, as the genitals are not neutral when it comes to scent. However, vaginal odor is a popular topic and quite a commercial topic, with many products that promote good smell down there and fresh vaginal scent and all kinds of other ways to promote this topic. The problem is that unless you're lucky and those products sit well with you, for the most part, they may easily disrupt the ecosystem of the vagina, irritate, not sit well, and they are frequent cause of gynecological office visit. So much as you may be compelled to try this wonderful spring smell product that will make your vagina feel so good, we hope that you will not go there. You may want to reach to one of those scented products because you think that you smell bad, or because a partner said you don't smell right down there, parentheses, whatever right means, or you think that your partner is not going to do oral sex on you because you don't feel clean enough, or the partner said something to the effect of, I can't do oral sex on you, I don't like how you smell. Unless you have an infection, this is who you are. And if a partner has an issue, get into the depths of it a little bit more. Is it something that the partner has a fixation on? Is it that the partner uses it as an excuse? Is it that the partner is used to certain ways and how you feel and look and smell is not something that they can cope with? Find out what is going on. I am clean, my vagina is fine, this is who I am. Why can't we do oral sex exactly? Of course, we would urge you to watch part 1, how to be sure that you don't have any residue on your genitals that may substantiate the partner's not wishing to do oral sex. But if you use proper genital hygiene, no, you should be all right. And if the partner does not wish to do it because they blame it on you, well, as I said, you have to explore this a little further. If you yourself feel that you don't smell right, is it really that you don't smell right? Is it really that there is a problem? Or is it that you think you don't smell right, or that you think you should smell differently? To solve it all, simplest way is go check with your gynecologist or your healthcare professional who takes care of your gynecological care, and to ask them, am I okay? Do I look like I have an infection? Do I smell wrong? Some women discharge more. Some women have a more of a smelly discharge. Sometimes it has to do with what one eats. Sometimes it has to do with the time of the month. So all these things are natural occurrences in the female genital, which are not a steady body part that does not change like the penis. The genitals, or specifically the vagina, is a dynamic body part, and it changes throughout the month, as you know very well. Of course, if you have your period, it'll smell like blood and it'll smell more acidic, obviously, but that doesn't mean that anything is wrong with it. If you use tampons, by the way, you will not be smelling so much. It's only usually when you use a pad that the blood sips down and emits its acidic smell that you could really smell more so during a period. But any of the insertable, like a tampon or a cup or a disc, typically eliminate the menstrual acidic smell. How do you know if you have a vaginal infection? Well, let me ask you differently. How do you know that you have a cold? The body sends messages. The body tells us something is not right. If my nose is running, or my eyes are watery, and maybe I'm stuffy, or maybe I'm coughing, it could be a cold. It could be something else, of course. But generally speaking, the body tells you something is happening in your upper respiratory system. Likewise in the vagina. How do you know you have an infection? The body sends you messages. You have a foul odor. That's not your usual odor. You have a foul odor. You may have a foul discharge. You may have a discharge that's cottagey or greenish. You may feel very itchy. All these are signs that something is not right and that it's time to go check with your healthcare provider so they can examine you, take a culture, tell you what's where, and sort it out for you. Now let's talk about genital hair. A common question: do I leave it alone? Do I trim it? How do I trim it? What do I do with it? Is there a need to do anything with the genital hair? Do I do it for me? Do I do it for the partner? Do all women do something with the genital hair and I have to do also? It sounds so confusing. And so many women are struggling with it because how many women know what the other woman does? There is really a lot of confusion about this issue and not always accurate information, not even on social media and all those platforms that share information so readily. The genital hair involved as a protection mechanism against whatever was flying in the air when people used to walk with no clothes. Obviously today we're not walking naked and there is no need to filtrate the element around us. So genital hair is still here. It's an evolutionary remnant of those times. Some women have coarser hair than others. Some women may be bothered by the coarser hair. Most women will have their genital hair get lighter, thinner, or even mostly disappear when they're in menopause. What do you do with the hair? It's really your choice. You can do nothing. If you have a bit of a coarser hair, definitely recommending a handheld shower so you could really rinse yourself really well, because the hair will trap soap residue, sloughed skin, toilet paper, some dried blood during your period, so you would like to rinse it properly. So a handheld shower does a good job for that, or a spray bottle, as we said in part 1 of this series of videos. But if your hair is not so coarse and you don't get so trapped, still, you can leave it alone. You don't have to really do anything with it. If you feel that it's too long, you really feel would like to get rid of some of it, you have different ways. You could trim it with scissors. Very simple. You could trim it close to your body. You could trim it farther from the body. Sort of like give yourself a buzz haircut, or not a buzz haircut, just a short haircut there. You could use hair removal products. There are different ones on the market. And you could try and experiment and explore which one works for you. Of course, be sure none of them irritate you. If it does, stop using it. Some women use laser. Some women use waxing. All of them are safe. They're fine. If you decide to laser or wax, be sure to get references for that professional. Be sure they're licensed. Be sure they use proper hygiene routine in their practice, so you will not get into any trouble, nor any burns or any mistreatment. But for the most part, it's very safe and it's good, and if that's your choice, that's okay. Some partners would like you to do that, would like you to remove the hair. Some women think that the partner might want you to remove the hair and they do it for the partner. You know, it's really about the two of you communicating. Is it something you like? Is it something I care to do? And if we arrive at an understanding which way we go ahead and do so. Some women trim the hair into designs. Yes, we've seen them too. Some women even put jewelry, of course, on their genitals. It's all optional. There is no harm. There's no danger in any of those options, from doing nothing to going all the way to full removal. So make a choice. Just be sure you're not forcing yourself into doing something you really do not want to do. Hopefully you learned something new. Hopefully we answered many of your questions about that. Please like, share, subscribe, and see you next time.